everybody knows who the Joint Commission is, right?
Yes.
Does everybody know who DNVGL is? The DMV? Somebody card her, get her driver's license? Okay. So, there's not just the Joint Commission anymore. In the world, and I say this, DNVGL healthcare, if a hospital no longer chooses to pay the Joint Commission is not a law. The Joint Commission is an entity that audits the hospital and gives the good housekeeping seal of approval. So several years ago, there started an issue in the United States where people didn't want to pay the Joint Commission. I've been around a long time. I remember when the Joint Commission started, because there were other competition for the Joint Commission. There was, It was, they had 4 names. There was another entity.
Yeah.
There was something, 4 names, I'll have to look it up. So, but then there was another one, it was like the quality something, it kind of went down the tubes. So DNV.
Not much quality there.
So DNVGL Healthcare actually it started in Norway, and it started 150 years ago, and it was in the shipping industry. It stands for Dead Norske Veritas. So it's a Norwegian thing, but they're the Joint Commission's competition. So this is interesting. They have a whole set of credentials for stroke. See all their different levels of stroke for a hospital goes to sit with them. So these are the Joint Commissions. The Joint Commission did them with the American Heart and Stroke Association. So Joint Commission is certified with the American Heart Association. They're dancing together, they're having a party. Over here, if you don't want to pay the Joint Commission, then you use the DNV suite of services. So these are cheaper than these. So if the C-suite decides to go that path, that's quite possible. So, and I have a whole bag of documents I'm going to pass around to show you this, but it's interesting, the American Heart and Stroke Association had this international conference, but certainly let them attend with their huge booth as big as this room, and of course the Joint Commission's booth was as big as this room, but they're all touting, hey, you want to be in an acute stroke ready hospital as opposed to a comprehensive stroke medical center, because you have to get those accreditations, right? But if you're not a Joint Commission accredited hospital, then this is the path you follow. That's an interesting piece of information. So then you end up with a certification. And once you get the certification,